Introduction. Opioids. Opioids are a class of drugs that are primarily used for management of pain. Particularly in case of severe or chronic pain, they are worked by binding specific receptors in the brain and the spinal cord known as the opioid receptor to produce analgesic and pain relief effects. Morphine is one of the examples of opioid used in treatment moderate to severe pain by Magustin Alpinol. Indication of opioids. Moderate to severe pain. Opioids are used to manage pain or varying intensity from moderate to severe. Cancer pain, they are prescribed to alleviate and often excruciating pain experienced by the cancer patient. Post-operative pain, opioids provide effective pain relief after surgery. Palliative care, they are a crucial component of the end-of-life care, improving the quality of life and for terminal patient. And acute trauma, opioids are used for the pain management following the traumatic injuries or accident, according to Centers for Disease and Control Prevention 2019. So comparing and contrasting opioid use for the different disease and population. Acute pain, post-operative. Post-operative opioids are used to immediate post-surgery period to manage surgical pain while the patient is recovering. Trauma. Opioids may be used for trauma-related pain, but the duration of the use of the shorter depending on the severity of the injury. Cancer patient, palliative versus curative treatment. Palliative care, opioids are essential part of the end-of-life, focusing to the pain control and enhancing the patient's comfort. We have the curative treatment. In some cases, opioids may be used during the cancer treatment to manage pain while actively fighting the disease, aiming for both pain and relief for cancer control. Pisces et al. 29. Number 3, chronic cancer pain, neuropathic versus musculoskeletal condition. Neuropathic pain, opioids are considered for severe neuropathic pain when other treatments have failed and often last resort. We have musculoskeletal condition. Opioid use for the musculoskeletal pain is controversial due to the concerns about the addiction and long-term efficacy. It's generally avoided when possible. Number 4, we have the pediatric population, postoperative versus chronic pain. Pediatric population, postoperative. Opioids can be used cautiously for pediatric postoperative pain management with a close monitoring for side effects. We have chronic pain during the pediatric. Opioids are generally avoided for the chronic pain in the pediatric population, and alternatively treatment are explored due to the risk of long-term adverse effect. And for the elderly population, acute and chronic pain. Acute pain, opioids can be used continuously for the acute pain in elderly with a careful dose adjustment and monitoring. And elderly population, we have the chronic pain. Opioids are generally discouraged for the chronic pain in the elderly due to the risk of falls, cognitive impairment, and other side effects, according to Pies et al. 2019. So nurses' role in evaluating the action and response of the opioids drugs. Assessment, we have assessment. Nurses are crucial in determining the degree, location, and features of the patient's pain. This evaluation aids to determine the efficacy of opioid treatment. Number 2, monitoring. Nurses are constantly monitoring the vital signs like blood pressure, heart rate, and breathing rate to detect any signs of opioid overdose or insufficient pain relief. This continual monitoring protects the safety of the patient. Number 3, we have the pain documentation. Nurses maintain the accurate and comprehensive documentation of their patient's pain level and reaction to opioid delivery. This paper is required for the healthcare team to make an informed opioid dosing decision, according to Tawalby and Tovaishat 2019. And education. Nurses educate the patients on their opioid prescription, emphasizing the necessity of the appropriately reporting pain and the side effects they may experience. Proper education encourages more responsible opioid usage. And lastly, number 5, the recognition of adverse effects. Nurses are diligent in acknowledging and handling opioid-related adverse effects such as respiratory depression, drowsiness, constipation, and nausea, providing the prompt intervention to limit the risk. According also to Tawalbi and Baisha 2019. Class substance, example, the opioid analgesic, morphine. In administered consideration, it is given parenterally or orally. Assess the pain prior to the administration, monitor the respiratory status, monitor the blood pressure, assess the pediatric and geriatric patients frequently, assess the bowel function used continuously with antidepressant and other CNS depressants. Example is naloxone is used to reverse the opioid overdose. So therapeutic effects, we have to relieve the moderate to severe pain. And the adverse side effects, it's number 1, the respiratory depression, confusion, hypotension, lightheadedness, dizziness, sedation, constipation, nausea, vomiting, and sweating. And we have also the opioid antagonist. It is naloxone. It is given parenterally and inhaled. Assess the reversal and the opioid effect. Assess the hypertension. Assess the return of pain. Naloxone has a shorter duration of action than opioid, and repeated dose are usually necessary. So the therapeutic effects to block the effect of opioid, CNS, respiratory depression, and the adverse effect of naloxone is agitation, tremors, drowsiness, sweating, decrease in respiration, hypertension, nausea, and vomiting.